Now, with a surge in kidney diseases across the country, managers of the renal unit of the whole teaching hospital say the facility is not adequately equipped to handle the overwhelming number of cases recorded. Authorities at the unit are thus appealing for help to provide quality treatment for the kidney patients who visit the facility. Citi News' Desmond Selassie Ago has more.
In recent years, Ghana has witnessed a steady rise in the prevalence of kidney diseases, posing significant challenges to public health. Factors such as unhealthy lifestyles, including poor diet choices, limited access to clean water, and inadequate health care, have contributed to the growing burden of kidney-related illnesses across the country. Chronic kidney disease, in particular, has emerged as a leading cause of morbidity and mortality, with cases often diagnosed at advanced stages due to limited awareness and screening programs. Amidst the escalating prevalence of kidney diseases in Ghana, the renal unit of the whole teaching hospital has issued an urgent appeal for the expansion and tooling of its facilities to address the growing healthcare needs of the population. The renal unit, which serves not only the Volta, Eastern, and Oti regions, but also neighboring West African countries, is facing a critical shortage of dialysis machines. With only 5 and sometimes only 4 working machines, patients are experiencing significant delays in accessing essential treatment, exacerbating their health conditions, and increasing the burden on healthcare providers. Dr. Jerry Doe, head of the renal unit, emphasized the urgency of the situation in a Citi News interview.
Currently, we have 5 functioning machines. And usually, we know dialysis is a procedure which takes over the filtration and then the excretion aspects of the kidney. And so we usually will counsel the patients, especially those on chronic dialysis, about the cost involved. And as they enroll, then we continue to see them. And the increasing number of clients that we are seeing is making us, giving us a toll on our hands. At present, we don't run a 24/7 service, but we work up to about 8 o'clock from Monday to Friday, and the weekends are reserved for emergencies.
Some patients' relatives who spoke to Citi News off camera said the unit's lack of some vital accessories is significantly affecting them and their patients. They want proper attention to be given to the unit. While advocating for healthy lifestyle living, Dr. Jerry Doe also called for increased investment in kidney disease prevention, early detection, and treatment services.
One major issue we are facing is financial support, and we are using this medium to appeal to diaspora, those who are from the Volta region in the diaspora, and all other stakeholders in the region, to put ourselves together so that we create a dialysis endowment fund. And we are going to come around to start the process of approaching the stakeholders so that through their support, we can create that fund so we can support especially the children and the needy. At the moment, we have a child that is 15 years old, end-stage renal disease, needing chronic dialysis. And the unit has been able to put something together and also fight for a pediatric catheter and then a filter. But the fact remains is that where is the financial support? As you speak, he's still struggling with his condition. So we are using this medium to also appeal for fund for this young boy so that we'll see if he can be sustained on chronic dialysis. The main advice is lifestyle modification. We need to watch what we eat and what we drink. It's a lot becoming a routine. We are taking too much of salt, too much of sugar, and that's the reason why we need to be taking these things in moderation. Also, we don't regularly check our health. So we are advocating that once a year or twice a year, you do a general screening for yourself so that you can easily pick up some of these conditions at the early stage. The truth is that when it is picked up at the early stages, we are sure that we'll be able to delay progression and also to improve quality of life.
For Citi News, I'm Desmond Selassie Ago.